Hello, you wouldn't be watching this unless you know all about GBS or CIDP or know something about it. So I'm not going to really say what that is, but tomorrow would be 12 months since I got discharged from my diagnosis with CIDP. Got discharged from hospital and rehab, so tomorrow is 12 months to the day. What might happen in hospital is not much sometimes, because you're there for observation. In my case, didn't really get much worse from the first few days that I was admitted. So I spent well over a month just under observation. But you don't know, it could have been getting worse. That's why I was there. Got some notes here to read and that as well, but I was admitted by a neurologist. He thought I had GBS or CIDP straight off, and they confirmed that the first week of hospital visits. So I was a little bit unsure about GBS or CIDP, but because of the length of time, the specialist decided it's got to be CIDP, so that was the right diagnosis, really. I was admitted on a Friday night, had my first IVIG that night. Saturday night and Sunday night finished about 2:45 in the morning. There are other things going on, some major hospital, so middle of the night, so these things happen, but I wanted to get that first course of IVIG done, so I did that. Yeah, it was a 250 bed hospital where I was. I asked who else is here with this. No one else with CIDP there. Hadn't seen anyone for quite a time. They put me in with stroke people, dozens of them really, I suppose, the whole floor, and yeah, it's not a real nice thing to be with people that have had operations with many stitches, and I'm well really, but I was there for observation, so they had to put me somewhere. I was tested with my breathing capacity morning and night, just to make sure I wasn't getting worse. You just feel like you're a talking head because you can't move much at all. In my case, I was like a talking head. You're basically paralysed. I could move a little bit with my fingers. I didn't have to be spoon-fed, but yeah, it's pretty confronting and everything. It's just people wouldn't know what it's like really, unless you go through it. Just going to the bathroom was kind of like what you think going to Mount Everest to be like. Just a really hard thing to do on a walking frame, and you're really struggling with a walking frame. So yeah, not real good. I had stomach injections because I wasn't very mobile. They were done daily. In my case, I was there for observation, like I said, mainly, but don't get very many visitors. You're away from home, things like that. The doctors walk around the wards, seeing other patients, And for me, because I wasn't getting any worse, I wasn't changing, I was there, and most of the time the doctors wouldn't go to me, they'd go to other people. Just how it is. You kind of just feel shoved aside, but that's just how it is. Doctors and staff were good, but because I wasn't a person that needed constant attention, you kind of get the feeling you're shoved aside a little bit. The staff asked if I wanted to be moved. In total it was 5 times they moved me, because I had other people coming in, needed areas for those people in the rooms. So they asked me if I wanted to be moved. That happened like 5 times, up and down floors, different floors. And I said, well, yeah, that's all right. You know, like I'm pretty stable, even though I wasn't that well, just stable. The specialist doctors asked me if I wanted to attend the once a week Friday meeting. There's about 20 specialists attended. I said, all right, so they pushed me down in a wheelchair down there and asked me some questions in the conference room, and I said they had an overhead projector, and they were discussing my case because it's rare. GBS is rare, CIDP is even rarer, and I wasn't getting any worse. I wasn't getting any better either, but I could answer questions and be moved around. So I did that, and so that's when they put their heads together, and later on they said, well, it's got to be CIDP, not GBS. So with hindsight, they were right. So can't argue with that. So it's good to have a definite diagnosis. In my case, I got it. So yeah, there is overlap with GBS, CIDP, the symptoms, but CIDP, of course, the nature of it is a much longer time period. Even with MS can be symptoms, similar symptoms, so it's totally different causes. So I think I could be either chronic progressive, chronic relapsing, or monoplastic, which, as far as I know, this is 12 months tomorrow. I've been discharged, so I wouldn't think I've been progressive because I haven't gotten any worse in that time. I wouldn't think I'm relapsing, haven't had any relapses. So I must be the perhaps once only. Give it more time, we'll see. Yeah, so if it's monoplastic, this disease, that'd be the better of the three. I think it's only like 10 to 20% of CID people are in that definition. So I think I would be in that definition so far. Give it more time, and time will tell. So it could be anywhere from 12 months to 3 years until you recover enough to know if that's the case. If you have a relapse, well, it's a relapsing. If you have like a period where you get worse, it must be chronic progressive. So anyway, you don't want to get hung up on terminology. So, so far, I'm going the best I can, I suppose. So, time will tell. Yeah, it is different being in the healthcare system. With CIDP, some people would say to me, when's your operation? Or when did you have your operation? Didn't have one. Don't get one. You don't get one with CIDP. You may not be able to breathe by yourself sometime in the next week, whatever. But yeah, it's different. So yeah, just some of my experiences when I was in that healthcare system. I imagine it's different for other people with worse CIDP symptoms than what I got, but I got pretty bad. So yeah, it's some ideas what it's kind of like with something very rare.